Good afternoon. Today is Monday, June 15th, and I hope you get this information by Tuesday, June 16th. No, I will not do this entire discussion dressed like this, but I just want to let everyone know that we still do need to take precautions. There are a few of my patients that think that COVID does not exist and it's a conspiracy, and I do not believe that is the case. There are many issues regarding this, but we have to get back to life in normal one way or the other. My goal is to make sure that my patients can get back to life and have a good life that is disease-free and promotes their health and well-being, your physical health, mental health, emotional health, and all of that. You'll be getting a lot of information now about a few changes for our practice. COVID is increasing and we are seeing a spike now. A month ago, you got information from me stating that there were 88 deaths in Orange County in the first 2 months of COVID-19. In the last 4 weeks, that number has gone from 88 to 221. It is definitely on the rise. I will not discuss the validity of those numbers other than it is here. I have patients. There are many people sick at Los Alamitos, and it's beginning to increase now. The building that I am in and Los Alamitos Medical Center has done a very good job of trying to protect the community, protect the individual people that frequent their facilities. My facility in particular has upped its game, is now cleaning everything on an hourly basis. Interesting is that I noticed something not being cleaned in the parking structure. I didn't think that was appropriate. I brought it up to administration. The problem was rectified right away. One of the benefits you expect from me as a concierge or DPC physician is that you don't have to be shoved around lots of patients. It was not long ago when my waiting room had 15 or 20 patients waiting for way too long, half of whom were sick, spewing disease and virus. That is not the case now. We do not want that to happen, and we do not want you around anyone else that is sick. My office has upped its game as far as cleaning protocols. Every room is cleaned after every visit. All the common areas are cleaned on a regular basis, and I think we've done a really good job. I want to make sure that you know that when you come to my office, we don't want you waiting in the waiting room, and no one will wait in the waiting room if another patient is there. You will be taken into an individual room. What we would like to do as we move into the future is COVID-19 has given us a benefit of moving forward with new technology. Through adversity, we gain strength has taught us that in medicine, the telehealth or the FaceTime or the Zoom visit has now risen and is being used on a regular basis. It is being reimbursed by the insurance industry and by Medicare, and many of my patients seem to like it because it decreases the amount of time you need to come to an office or a medical facility. But with the advent of all of the new electronic advances we have, I'd like to thank you all for participating with me. There are a few things we would like to implement or actually improve and perfect upon. Before you come to my office, I would always like you to call. First, always call. If it is a true medical emergency and you need immediate attention, you know that's 911. For anything else, you should be calling my office and we will triage your call. I made the promise to get back to everyone within the hour for an urgent coronavirus issue or I'm sick question. And we're trying to maintain that. And we have, I believe, for most of the last 3 months. Call the office, we will triage the call, and we will try and do as much proactively, preemptively over the phone as possible. Interesting, in the mornings, the phone lines are a little bit busier. The afternoon is a little calmer. I will tell you tomorrow in my newsletter to you that if you call in the morning, we may be a little bit tight on time. We will call you back later in the day. to get the salient information we need from you. So we may make the appointment at 10:30 for the next day, but we'll call you in the afternoon and discuss what needs to be done. I will try and figure out, do we need laboratories before I see you? Exactly what is the illness we're addressing? If we can take care of the business or your medical needs by phone, we will. If we can take care of your issues with a Zoom call and not see you at all, we certainly will. If I must see you, we will do so, but we will do so appropriately and with the right information beforehand. So when my office calls to triage the call and get more information, the one thing I will like will be the medication list. We call it the med reconciliation list in the office and in the hospital. That will give my staff a chance to talk to you about your medicines, and maybe it'll be easier where you have all your medicines in front of you at home. You can look at the bottle, go through the dosage, and that can be done before I see you. I think this will help the office visit. I will make sure my staff gets the right information, and this will save us all the trauma of me firing questions at you and asking you questions in rapid fire delivery. It'll be good for all our blood pressures, and hopefully the information will be there in front of me, ready to go whenever I do talk to you or see you in person. So that's basically the summation of it all. I want to be able to see you when you need to be seen, take care of your problem over the phone when it can be done over the phone, or do a Zoom, teleconference, FaceTime visit when that is necessary. All of these things are important for getting through the COVID crisis. It will make getting through medicine in general be better and safer and more efficient for you. The less people that come to a medical office, the safer it is for everybody. It decreases everyone's risk, and that's something that I promise you, I promise myself, I promise my family that we need to do. Again, I encourage you to get the exercise you need to do on a regular basis. Avoid mind-altering substances to the best of your ability. Doing the exercise and avoiding those substances and participating in what type of mental wellness activities you have is very good for your mental and your physical health. It helps train you to avoid the physiological response we have to emotional stimuli. Lately, we've had emotional stimuli everywhere, triggering us all the time. That's what we're trying to address, because it is better for us to avoid that physiological response. The migraine headache, the hypertension, the irritable bowel syndrome, all of those things are not good for us short-term and long-term. Again, you should be practicing social distancing. You should be wearing your mask whenever you're out in public, whenever you're going anywhere you don't know who's going to be there. Gloves when you go through areas where you're going to be using your hands a lot. Hand sanitizer, frequent hand washing. I think we're still a little bit a ways from going to sporting events and closed arenas. I think we still don't know what's going to happen with COVID-19. We will find out this summer, but we will find out safely, and we will find out the right way, and my job is to do my best for my patients. Thank you very much. You'll get this in newsletter format that hopefully is a little better than me telling you. But thank you very much for your consideration, loyalty, and patience. Thank you.